Kalea Clark.
Oh, okay.
You can have a seat.
Hi, my name's Kalea.
I'm Miss Clark.
Okay.
We can start off by you telling me about yourself.
Okay. I'm actually a recent graduate of the practical nursing program at South Florida State College. Since I was 14, I've had a passion for nursing, actually. I've wanted to become the nurse that I would want to care for my own family. So now that I've completed school and moved to Orlando, I'm actually eager to work at the life care centers of Orlando, here in Orlando as an LPN.
Why did you choose nursing?
I actually took an aptitude test in the 8th grade, and the results said that my most dominant quality was that I was caring, and so they said that I would do best in a career where I am caring for others. And from my experience, nursing is the most caring profession, and it's the most self-sacrificing profession that there is.
And how would you respond to a patient who constantly demanded pain medication?
Well, with that situation, I would educate this patient on different pain coping mechanisms, such as acupuncture, hypnosis, guided imagery, distraction, and various herb supplements as well. I would tell them this information at a time when they're not in pain, because if I educate them while they're not in pain, they're actually able to understand better. Also, I would encourage them to medicate when the pain is tolerable so that it doesn't become too much to bear.
And how do you accomplish a lot of work in a limited amount of time?
Well, that would involve having good time management skills, so I would complete the most important tasks first. I would make sure I do one task at a time, and I would also not procrastinate.
What are your educational goals?
I plan on working as a licensed practical nurse for a year, and then I'm applying for the LPN to RN transition program at Valencia. And then once I complete that program, I will go on to complete my BSN for nursing, Bachelor of Science.
And where do you see yourself in 5 years?
In 5 years, I see myself as a graduate of the Bachelor of Science program. And my nursing specialty is going to be orthopedics and sports medicine.
And how do you handle stress on the job?
I handle stress by allowing myself to take breaks to center myself. I also allow myself not to bring my work home and not to bring my home to work. I give myself reminders to accept the things I cannot change and to have the courage to change the things that I can.
What are your strengths or weaknesses?
Well, my strengths are that I'm caring, I'm determined, and I'm passionate. While these are my strengths, if they're utilized incorrectly, they can become my weaknesses. So for example, I'm determined. So I'm determined to achieve any goal that I make. No matter if that was earning honor roll in high school while working and playing on the tennis team, or becoming an RN by taking the LPN to RN Bridge program. I always find a way to complete my aspirations. This can also be a weakness because some things aren't as black and white as they seem, so to speak, and things don't end up the way they want them. So an example of that is I applied for the RN program, but I didn't make it in. That was pretty upsetting, and I kind of beat myself up about it a little bit. But that same determination, I used that to apply for the LPN program, and I got in. And I'm able to bridge into the RN program. So, in the end, my goal is going to be reached.
Tell me what you feel is your greatest skill as a nurse.
As a nurse,
Yeah.
I feel like that my greatest skill is that pay very close attention to detail. There's actually been situations in the clinical setting and in the classroom where I saw a very small amount of information, and I was, and even some like overlooked details, and I was able to examine them and get a whole abundance of information by noticing small things.
And how do you deal with the patient that is not satisfied in their care?
For a patient who's dissatisfied with their care, I would ask them what it is that isn't coming up to standard. And then if I'm able to, I would correct this. If I'm not able to, I would try to, within the physician's orders, try to modify it. So for example, if a patient was upset about being woken up early to take their medication, I would see if I would ask the physician if they're able to take their medication a little later in the morning still, but a little later in the morning. And if not, then when I do my med pass, I would actually kind of put them at a little closer towards the end of my med pass, and that way they get a little more time, and turn on like a minimal amount of light so that they're not woken up so much, and then I'd help them comfortably get back into bed so they can go back to resting.
Are you comfortable working with other doctors and nurses?
I am absolutely comfortable in a group setting.
And what do you find is the hardest part of being a nurse?
The hardest part, I would say, is not knowing not everyone is receiving the best quality of care. There's some nurses who just see this as a job, and they just see this as a paycheck. Whereas there's others that genuinely care about their patients and how they're being cared for. And so it's a little disheartening, those that don't care as much, but I try to do my best and put patients' needs first and be a patient advocate.
And why do you feel you're the best candidate for this position?
I believe I'm the best candidate for this position because not only do I have the qualifications needed, I strive to go above and beyond. I'm always willing to learn, and I'm always striving to improve my skills in any way.
And what type of supervisor do you appreciate?
I appreciate a supervisor who's more of a democratic leader, a supervisor who allows you to complete your task independently, but still finds time to praise employees for their hard work. So a balance between both.
And why do you want to work here?
I want to work here because from my research, this company has received rave reviews and various accolades. In fact, the Life Care Centers of America has received various awards overall for Faculty of the Year at least 7 of your locations across the United States. You're also number 148 on Forbes' America's Largest Private Companies of 2019. Besides that, the missions and values match my own. The first being that we believe our residents are the highest priority. So I really agree with that, and I want to be a part of the team.
And tell me about a time you worked with a difficult coworker.
Well, I actually had a supervisor once who was actually very racist, and he didn't like anyone outside of the Caucasian race. He felt as though others were lazy, and he assumed that they wouldn't work, or that they would work, but it would be very poorly. So I actually went above and beyond with my work, and I even offered to help him. And after a month, that supervisor came to me, and he said that he was sorry that he judged me incorrectly, and that I was one of the hardest workers that he'd ever met. So I really made an impact on him.
Describe a time when things got hectic. How did you handle it?
Well, a time that something was very hectic was I actually used to I actually used to work at a movie theater, and when I worked at this movie theater, there was a time, a very busy rush, a winter rush, where there's a lot of people that come in, get a lot of snacks. It's just a lot of ruckus going on. So with that, I just worked with my other team members. I made sure that they were doing okay. I made sure I was doing okay. I made sure I took my breaks. Even though it was very hectic, I still had to take care of myself. I made sure that the customer's needs were the most priority. So, although I was at a movie theater, I can use those same tactics in the healthcare world as well.
Tell me about a time when you effectively educated a patient.
I actually had the opportunity to educate a patient during my clinical experience at the Orthopedic Institute, the Highlands Regional Medical Center, in March. I actually had a patient who wanted to know why he was taking so many medications. He was taking Tylenol, Lyrica, and Celebrex. And he was wondering why he was taking that with a sports drink. Like he had to take that in a sports drink. They called it TLC. And it's a preoperative medicated dose. And I was telling him that these medications, they would decrease his inflammation, his pain, and it's even been shown in various studies that it promoted faster healing after surgery, considering the electrolytes in the Gatorade. And after hearing this, he was actually really excited, and he said that he would take his medications because it seemed like I really knew what I was talking about. So, I mean, it seemed kind of simple explaining that to him, but he appreciated that I cared and that I knew so much about the topic.
Have you ever accidentally caused a conflict?
I have. When I was younger, I used to cause conflicts because I would be uncomfortable with something and keep it to myself. So there was a time where I actually was uncomfortable with something, and I went months just allowing this problem to eat at me. I didn't say anything. I was uncomfortable to a point where I couldn't take it anymore. And I went to the other person and I talked to them about it, and they said that they were just shocked. They were like, I wish that you would have told me, because then I could have stopped this uncomfortable situation. I didn't even know it was eating at you. It wasn't so much a conflict with them. I guess it's more of an internal conflict. But I learned from that whole scenario that it's important to voice your opinion, to voice what bothers you, what makes you uncomfortable. Even if you don't want to upset the other person, because maybe you won't upset the other person. And it's just always good to keep a good line of communication.
And can you tell me about a time you persuaded a patient to do about something?
Well, actually, I would definitely say that patient who didn't want to take their medication, I would definitely say that was a time where I persuaded someone about something. I've had a couple patients in the clinical setting that didn't want to ambulate, and I told them about, like, with early ambulation, even though it may kind of hurt, if you kind of do a little bit at a time, ambulating, like early ambulation, it's very good for promotion of wound healing. So I promoted them to do that. I was like, it'll help you feel better faster, and that actually persuaded them a lot of times.
Well, that's all the questions that I have for you today. That was very nice meeting you.
Do I have the opportunity to ask you a couple of questions as well?
Yes, you can ask the questions.
Okay. How many LPNs do you actually have here at Life Care Centers of Orlando?
We currently have 7.
Okay. And then how many residents do you have?
About 100.
During the COVID-19 crisis, how were you guys prepared for this?
We had backup inventory, and we also had other nurses that we could call on if we needed extra help.
Okay.
During this time. But other than that, we weren't really as prepared as we could have been.
Okay. Right. For now, that's all the questions that I have.
Are you sure that's all the questions that you have?
Mhm. Yes.
Well, I will be in touch with you as I consider your application.
Okay.
It was nice meeting